Centers for Disease Control and Prevention releases new guidance on who is considered a close contact, and that could potentially expand the pool of people who are at risk of contracting COVID. In today's Once for Wellness, Brooke Katz explains this would likely impact schools, workplaces, and other group settings.
A close continuous contact was previously defined as someone who spent at least 15 consecutive minutes within 6 feet of a person infected with coronavirus. Now it's defined as someone near an infected person for 15 minutes or more over a 24-hour period of time.
People who are going to need to go under quarantine is going to expand.
Dr. Diana Cervantes, assistant professor of epidemiology at UNT Health Science Center, points to a study that found a correctional officer in Vermont caught the infection from COVID-positive prisoners. In an 8-hour shift, the employee came close to an infected person about 22 times for a total of 17 minutes.
The strength of this study is that it's in a correctional facility, so people are being monitored by video throughout their whole interaction. So they were able to identify a person.
The study also found that while the official was wearing a mask, some others at the facility were not masked all the time.
Trying to emphasize that it's the importance of layering. You have to keep that 6 feet distance, making sure everyone's wearing their masks and protective equipment. And just because you're wearing a mask doesn't mean it negates you from being a close contact. If you're within 6 feet for 15 minutes or more, throughout 24 hours, you're going to be a close contact.
This could impact schools and offices and perhaps social gatherings as well.
Schools, of course, rely on teachers. They're going to have to get more substitutes. There's going to be more people that are potentially out of the workplace because they're under quarantine, because now they're considered a close contact where previously maybe they weren't.
Brooke Katz, CBS 11 News.
Well, Dr. Cervantes says when it comes to protection from COVID, consider a layered approach. Each time you add a layer, you are more protected. First, though, keep social distance, wear a mask, and wash hands thoroughly. We cannot say that enough. The Texas Education Agency is reviewing the updated CDC definition of close contact as well. In a statement to CBS 11 News, it says, quote, while the definition continues to evolve with our understanding of COVID-19, our guidance takes into consideration factors such as contact, mask ventilation, presence of dividers, and case symptomology. Adding, as Texas public schools continue weighing decisions regarding school operations and potential closures, each individual scenario should be determined by an appropriate public health agency.